We don't deal with that, but without touching on it, so I think it's gonna,
Here. All right, the time is now 4:15 PM. I call to order the Health and Mental Health Committee meeting of the Orange County Legislature. Please note this meeting is being transmitted via live stream. Please silence your cell phones and tablets and other electronic devices. And if you would now kindly join me in the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We do a roll call?
Emo, Anagnostakis,
Present.
Ellers, Fagion,
Here.
Luhan,
Present.
Sutherland, Patel, Tui,
Here.
4 present, 4 absent.
Okay, seeing that we have 4 absent, we do not have a quorum for today's meeting. So we will go through some of these items here. We won't be able to vote on them today. Some will be rolled over to the Rules Committee tomorrow. And with that, we have four absent today: Michael Amo, Janet Sutherland, Glenn Ellers, and Lori Tortel. All right, first up is Commissioner Miller, Social Services and Mental Health. Darcy Miller.
Good afternoon,
Hello.
how are you? Yes. Okay.
All right, Darcy, so obviously we're not going to be able to vote on this first agenda item.
The time sensitive?
And now just for point of order, Chairwoman Benelli.
This issue will be, we spoke to staff and we will be putting it on the Ways and Means Committee.
The Ways and
On
Means
Tuesday.
Committee on Tuesday?
Tuesday.
Okay, very good. I will make sure that that gets into our calendar. Thank you.
Thank you.
Yes.
Okay, Commissioner, so if you want to go into item B for your monthly update.
Sure. So you know that on July 17th, the National Suicide Lifeline went to a 3-digit number. You know, we continue to support our 311 3-digit number here in Orange County. But we have been answering our own lifelines. Mental Health Association has been answering our own lifeline calls for about 9 months now. And they continue to answer the 988 calls. They have doubled, as was predicted, that lifeline calls would double with a 3-digit number, and our local response has doubled as well. So they typically got around 30 calls from the lifeline using the 10-digit number a week, and now they're getting 60 calls a week from lifeline. So they're about 1,100 calls a week that they're getting now
Wow.
across, you know, all the areas that they respond to. So you know that Healing Community, the Night of Healing Community, as well as opioid settlement funds, both are being implemented at the same time. We have a steering committee. Legislature Sutherland represents all of you on our steering committee, and we're actively moving forward. The Healing Communities, which is a research study through Columbia, requires us to hire a communications expert, which we're pleased to have a communications person come on board. Because if people don't know how to get the service, they are not going to reach out for the service. So that is something that we're required to have for the time of the grant, which should run through December of 24. And we are seeking that position to be filled. The opioid settlement funds, we had a meeting on July 17th and prioritized access to the system, the front door to the system, and transitions. So when somebody is coming out of a rehab and moving back into the community, and also transportation. You know, that I like the 311 call center took a call the other day for a gentleman who was looking to go into rehab, who was eager to get into rehab. They were able to find a place for him. There was no transportation. So they called Medicaid transportation. They made an exception, and there were no taxis in Orange County that would be able to take them. So they called Medicaid transportation back again, and they said, we'll send a limo. So if you can imagine that much work on the part of so many people, including state who makes the decisions about Medicaid transportation, did everything to ensure that this gentleman was able to access care in a timely way when he needed it. So we're very excited by that. Also, our opioid response team, I just want to say, you know, there's so many people who get concerned about harm reduction and is it really helpful? And, you know, people who overdose and then, you know, overdose again, you know, what can we do for them? Well, there's a gentleman from Port Jervis, as a matter of fact, who overdosed 11 times. And his 11th time, they received the response and the continued attempts in between. He is actively in treatment, in rehab, and has remained there. So it works.
Success.
Keep reapproaching. It's a welcoming approach. What do you do the 10th time? He said, I'm glad you're here. Let's get this done.
Yeah.
And that's the stuff that excites me. So really good work. I'm part of so many people. And let me see. So for school satellites, there's so much wrong about not having enough support services for young people, and we still don't have approval from Office of Mental Health to begin our Monroe Woodbury satellite. We have Goshen who's already done their MOU. We have Highland Falls that's in the work. We have Cornwall that's in the work. We have SUNY Orange that's, you know, possibly a good candidate. We have to be able to move these applications forward. So we did advocate with the state office to really help us. They're the ones who make the decision. We have to wait for them. So to really help us respond to our community needs
And
by
what's holding
approving
up
these.
Monday, Woodbury? That's been in the works.
Just simple, they need to approve the plan. So they have to go in and approve everything that's written up, they have to approve the budget, they have to approve the space, they have to say, okay, you can open an office of mental health licensed satellite in Europe.
So will this hold up all the other schools that you're working on too? Is
We
it-
try to do one at a time.
Yeah.
So, they're all in order, waiting to go through, so yes, it does
So
kind of
this
hold up.
log jams everything.
But we did start the next one while we're waiting for this one to finish, so we just, keep them, then we have to hire staff, so that's our other challenge.
Work in progress.
Trying to get folks in. Positive, they have been able to hire some of the staff using the Assemblywoman Gunther funds, and we're pleased that the holdup there has really been workforce issues again. But we do have some staff filling those positions and out in the field. At Legislator Tortel's request, I went and met with Highland Falls Community Center. There was also representation from the school district there. I'm really feeling like they didn't have enough connection to services. I brought a team meeting together with Access Supports for Living, our Department of Social Services, Cornerstone, which has a satellite clinic over there, Independent Living and our peer supports. What a great group of folks. Everyone is connecting with the center over there. They're going to commit some hours where they'll be able to be there, where they can advertise to the community that those supports are available, just to be sure people have a face-to-face to be able to make a link and connect to services. So we just didn't want them to feel so isolated as they have in that community, and I appreciate our service providers who will come together to make that happen. And let's see. Our 0 to 5 committee, which we've been talking about in this meetings, we have a date set. Georgetown University will be our technical assistants for this meeting, and it's really to bring our stakeholders together, our health department partners who are in the room, mental health services, and daycare and childcare, and bring everyone together to be able to support our 0 to 5, knowing that they have, if we can address their issues at that age, their academic success, their social success is so much greater. So we'll do a full mapping of our services we have in this county. We'll look at our gaps and we'll look at how we fill those gaps. And again, a great collaborative effort. We appreciate Georgetown University. They're not charging us for their work. It's part of their mission. So we're excited to be able to offer that to our community. We're currently working on the governor's healthcare bonus funds. We are able to, there are vesting periods or 6-month periods. They run through 2024. The first one began, if my memory serves, in March and ended 6 months there. So we're currently doing retroactive for our employees who meet the criteria. Really appreciate the support of Human Resources. We're working closely with Valley View Health Departments where we get on board to look at their staff too who's eligible. And we have quite a few staff that will be receiving. Anyone who worked 20 hours during that 6-month vesting period will get $500. Anyone who worked 20 to 30 hours will get $1,000, and 35 to 40 hours will get $1,500. So staff who worked will be able to get from their employer, or with their employer submitting their names, will be able to receive up to $3,000 total for 2 vesting periods during the eligible time. So we're excited that we have many staff who will receive that fund. It will come in through the county, and then we have to sort out how we pay it out. But it's a great effort to really kind of boost and help us retain our staff.
And, Darcy, so those are state funds coming in, right?
Correct?
Okay.
Yep. Oh, yeah, those are all,
Yep.
well, I'm not sure what funds they're using because it's coming through a Medicaid remittance, so maybe federal and state funds. But at the end of the day, I'm very excited that they put this forward for our staff. It's just a little boost for all of them. And that's it for me.
Hey, any questions, comments, legislators? Oh, okay, well, Darcy, thanks a lot.
Thank you.
Appreciate it.
Have a good afternoon.
All right, you too. Okay, next up, we have item number 2, Peter Toohey, myself, Chairman of the Health and Mental Health Committee, Louise Abramson, founder of Cultivating Healing and Justice Initiatives and Support Services, Inc., Luis, if you could come up and have a seat right here.
Hello.
And welcome to our meeting today. If you could give us a quick briefing on what exactly that you're doing in the county in the Hudson Valley.
So, I prepared a quick, brief, overview. I'm a prostate cancer survivor, so I opened up this, program, specifically for that. So one of the things that we're doing is, prostate cancer awareness and screening initiatives, and throughout the Hudson Valley. So I'll start by saying good afternoon to the Health and Mental Health Committee, Mr. P. Tui, and the committee chairman and commissioner and committee members and ladies and gentlemen. My name is Luis Abington, and I'm the founder of Cultivating Healing and Justice Support Services. My experience as a patient who went through cancer treatment and saw how this illness affected my family along with other survivors and friended during my recovery is the reason why my wife and I decided we needed to brainstorm and bring a prostate cancer awareness and emphasize on how important screening is. This particular cancer has been stigmatized. There is the tearing down of the male masculinity, along with the mental and physical discomfort believed to take place with the screening process. This is how our organization was born in 2021. We hit the ground running, and from the time until now, our organization members, along with us, have been promoting advocacy, putting in place charitable community events. Our first walk in Otisville this past May, 2 car shows in Chester, New York, and we participated in fairs, setting up a informational booths. We were a participant in a trial in which a mobile health van was unleashed for our walk and car show to bring free prostate screening to eligible men. Our aim was and still is to reach members of the underserved, those without access to healthcare, and the misdiagnosed, the healthcare state challenges, and how the challenges can drain the patient and family. Is why we started a food and basic essential needs pantry to help support the medical needs of prostate patients. This disease is not only physically and mentally draining, it can be a financial burden. Our continued mission is to assist, advocate, and establish state legislation that can combine education, screening, and mental health wellness, and follow-up care for inpatient, outpatient prostate cancer survivors. And we went to provide resources to be able to assist the patient's caretakers when the patient loses their battle with this disease. Early detection is a start, and missing information can be a community fear in regardless of man, race, or creed. We look forward to continue our community work. We are actively assisting families through the Hudson Valley, and we look to collaborate, promote, and partner with organizations, businesses, and anyone that would like to help us make possible to raise awareness of prostate cancer, a cancer that affects 1 in 8 men, 1 in 4 Black African-American men, and 1 in 5 Latino men. In our past events, the walk in Otisville this past May and car show in July, we were able to screen 50 men and not charge by a simple blood sample or PSI to men at risk. Until the results are back, then the patients will know their status, and if the blood result come back in certain number, the provider will then send the patient for further evaluation such as an MRI, a CT scan, or a biopsy. We collaborate with the one-of-a-kind mobile prostate cancer screening unit from Mount Sinai Hospital that has traveled from the city of New York to the Hudson Valley to help us with the free screening. Per the CDC, analysis revealed that incidence of metastatic prostate cancer is increasing. And in 2022, there will be an estimated 1.9 million new cancer cases diagnosed and 600,360 cancer deaths in the United States. Prostate cancer is #2 cancer that kills men. We do want and will do with dignity, with respect and care to elevate the service for our community. It is important for our elected officials to understand the community needs, and people are dying from inability to treat the disease. So thank you for your time. If you have any other questions to ask me, you can, and on behalf of the Cultivating Board, Healing and Justice Support Services, and our advisory board of urology doctors, thank you for having us here today.
Luis, thank you very much. And can you just tell us a little bit more about the mobile unit and the accessibility of it here? And,
Yeah, so
I know that when we first talked,
Sure.
Mount Sinai, and it was affiliated with a hospital up here, or did that ever work out, or how did it come about to getting it here finally?
no, so the pilot program was in emphasis in 2018. 2019, there was a $3.8 million donated by the Foundation for Robert F. Smith. With that funding, they were able to create a mobile unit that has a MRI system, top of the line, with an office and screening, technicians, nurses, and a urologist. The purpose is to bring down the instances of this cancer, because this cancer is its unique traits is that there is no real signs until much older.
Stigma.
And besides the stigma as well. And it basically affects families all over, from veterans to first responders to people alike. Right now, they've done over 700 screenings. The goal is to get to 1,000 and then look at the hotspots. I was instrumental in starting the conversation to have them start coming here to Hudson Valley, because we have a lot of community members here, the first responders, veterans, and alike. Prostate cancer is not unique to the city of New York. It also is a problem here in Hudson Valley and here in Orange County. So far, the way that we utilize screening is that we try to go to events where there is more possibility of higher rates of men collectively in an area, so we can have a higher catchment. We have a secure site that we do every year now, which is the car show that some of the members here, the elected officials, have gone to. In Chester, we have another site in Otisville, and we plan on expanding to other areas within Hudson Valley.
And will the mobile unit be coming back too? Or-
Oh, absolutely.
Yeah.
We are in talks with bringing it to Monroe, as well as to the medical beltway here in Walk Hill. I think that's it's a much needed conversation. There are a numerate of needs, and they need to be gapped. Mental health is one of them as well. Bringing this system would allow a screening that normally is not offered. Free screening is not something that's offered right now. There is a bill that is trying to start making the rounds to have about 7 different cancers be free screening within New York State. New York State has always been the leader in healthcare, and we're moving towards that. That bill needs support. It needs support by the constituents, it needs support by elected officials. But as you see, this is a need.
Absolutely. Well, in one of the efforts that you're doing, and the legislature is very glad to be working together with you to bring awareness about. And so what we have here is a resolution of the Orange County Legislature designating September 2022 as Prostate Cancer Awareness Month. And what we'll do is we originally intended to vote on this today, to move this from committee and be able to go take it to the floor of the chambers right next to us on September 1st. But since we did not have a quorum, this will be rolled over to tomorrow's rules meeting, and we'll be able to vote on that then. And then we'll like to have you back on September 1st too, when we actually pass the resolution. But right now, I'd just like to read it real quickly while we have everyone here and while we're online. Whereas more than 3.1 million men in the United States are living with prostate cancer, and whereas 1 in 8 men in the United States will be diagnosed with prostate cancer in their lifetimes, and 1 in 41 men in the United States will die from prostate cancer. And whereas prostate cancer is the most commonly diagnosed non-skin cancer and the second leading cause of cancer-related deaths among men in the United States, and whereas the American Cancer Society estimates that in 2022, about 268,490 men will be diagnosed with prostate cancer, and about 34,500 will die of prostate cancer. And whereas 40% of newly diagnosed prostate cancers occur in the men under the age of 65, whereas the odds of developing prostate cancer rise rapidly after the age of 50, whereas African Americans have a greater risk in prostate cancer, is almost more likely to be aggressive and advanced with Black individuals, and whereas having a father or brother with prostate cancer more than doubles the risk of a man developing prostate cancer, with a higher risk for men who have a brother with the disease and the highest risk for men with several affected relatives. Whereas screening by digital rectal examination and prostate-specific antigen blood test, PSA testing, can detect the disease at the early and more treatable stages, which could increase the chances of survival from more than 5 years to nearly 100%. And whereas men 40 years and older should have a conversation with their medical provider about PSA testing and other health exams available. Whereas only 30% of men survive more than 5 years if diagnosed with prostate cancer after the cancer has metastasized. And whereas there are typically no noticeable symptoms of prostate cancer in the early stages, making appropriate screening critical. And whereas ongoing research promises further improvements in prostate cancer prevention, early detection, and treatment. And whereas educating people, including healthcare providers, about prostate cancer and early detection strategies is crucial to saving the lives of men and preserving and protecting families. Now, therefore, be it hereby resolved that the Orange County Legislature designates September 2022 as Prostate Cancer Awareness Month and declares that steps should be taken to raise awareness about the importance of screening methods for and treatment of prostate cancer, and to continue to consider ways to improve access to and the quality of healthcare services for detecting and treating prostate cancer. The Orange County Legislature calls on the people of Orange County, interest groups, and affected persons to promote awareness of prostate cancer, to take an active role in the fight and devastating effects of prostate cancer on individuals and families, and to preserve Prostate Cancer Awareness Month, and to observe Prostate Cancer Awareness Month with appropriate ceremonies and activities. And it will be dated September 1st, 2022. And look forward to doing that and seeing you back on September 1st.
Thank you so much.
Thank
you so much for that.
Oh, yeah, okay. Legislator Lujan.
Thank you, Mr. Chairman. First off, thank you so much for what you're doing, and obviously it's wonderful to see that people are leading the charge on this. I did have a question in regards to one, the resolution that you mentioned that's going to New York State. If you can maybe just talk very briefly a little bit more about that. And two, I want to just offer my extension welcome. If you will, I don't know if you have someone in the city of Newbury that you're speaking with, I'd be happy to help with that, and we can talk offline about that. And love to bring you to the city of Newbury for some events
Sure.
someday in the future.
I would love to do that. I want to do that. Right now, currently the way it sits, for this particular cancer, there is a bill, but it has not really, it's still in the premature stages.
Mhm.
But the all in all of this bill is this going to cover seven, and it's colon, cervical, prostate cancer, breast cancer. Right now, there's a separate bill for breast cancer that is making further headway. It's led by three senators, the 18th, 14th district. I think that going forward, bringing more awareness to what is going on. I would say I believe in 2012, there was a committee formed by the United States with 7 doctors to look at what ages was best appropriate. There was also a category given to PSA, and it started out with a letter I, now it's with a D. And what that's caused is that the PCP views it as more of a request from the patient, and not something that is standard in their practice, versus the urologist looks at it as this should be taking place. In my personal opinion, I was diagnosed at age 40. I have met men at age 35. My numbers were extremely high, and my diagnosis was so unusual. I went for a physical here in Orange County. Later found out that a lab had done an additional test without the knowledge of the physician. And therein is when I found out that I had cancer. So obviously that there is a gap, and that gap needs to be filled, and the errors of the past need to be remedied, because this conversation should happen at any of our physicals as men, and it shouldn't happen at such a age, such a late age. It should happen way sooner, and we should have this conversation with our family members and with and so that we do know the history of our dads and our grandparents, so that we can better be able to make our decisions. There's quote unquote, the men don't care about health. We do care about health. I think many guys work out pretty good. We want to be here a long time. And so I think it's the complete opposite. I think that we deserve more dignity. And I think that moving forward, I think that this would be a good step to changing that. And we'll start seeing some decrease in the county when it comes to prostate cancer. This is a very curable thing, and there's no need to allow it to become metastatic.
Thank you again.
Yeah.
Yes, legislative staff.
Thank you, Chairman. Louis, thank you very much for being here. I had the privilege to actually see the man in action in the field. I commend you for the work that you do. And it's a simple antigen test that's done while blood work is taken, looking for other things, and it's not costly at all. And I don't see why everyone that's got insurance should be getting it at a relatively younger age, whether it's 25 or 30. And people that don't have insurance, there should be ways to provide that test to them. Again, it's a minimal cost, and not only do you save a life, but you save a ton of money as opposed to having to go through the treatments. So as a preventative measure, it's a thing that should be done for that disease and other diseases.
Mhm.
But I want to thank you for all the work that you do in the field.
Thank you. Thank you, Luis.
Thank you, gentlemen.
Let me give this to you too. This is just a copy of it. Like I said, we'll catch up after tomorrow's meeting, let you know, all right?
Thank you very much.
Thanks, thank you, Karen. Okay, up next, we have item number 3, Lawrence Ledoux, Commissioner, Valley View Center. Donna Strecker, Director of Finance, Valley View Center. Good afternoon.
Good afternoon.
Hi.
First up, we have our monthly financials.
Hello, everyone. The results we're reviewing are for July reconciled to the Orange County General Ledger as of 8/10/2022. There's been no change in the IGT funding since the last publication of this report. No change in the emergency disaster funding of the 3.2 million. Other revenues are coming in at 19,845,000. On the personal service side, we've expensed $11.3 million for payroll. Equipment, we've expensed $33,767. On the contractual side, we have just under 3.8 earmarked for expenditure, and we've actually expensed 4.7 million 73. Employee benefits were coming in at 9.5 million.
Donna, just with with that contractual, looks like it's about $1 million more in actual. Where did that come from?
It's not,
On the 3.799371 was the encumbered expense. And then the actual is
4.7.
Yeah.
Yeah, so when encumbered expenses happen, it means that we've created a requisition or a purchase order, and it's just waiting to be paid, or the product to come in, or the service to be received. So that's why you see that difference.
So what happens is after the encumbered expenses are paid, they move into the next column that you see there, the
So
4.773.
altogether you have 4.
Correct.
Okay,
Right.
Thank you.
You're welcome.
Legislator Anagnostakis.
thank you. You're done with the general ledger, I assume, so I'll ask some quick questions on it if I can. The emergency disaster, 3.216 million, that's the total amount we expect this year from
That's
that.
what we've actually received.
Right, but do we expect any more on top of that?
I have not heard of any funding opportunities. It would be phase 5. This was phase 4.
Okay, and that's new this year. We didn't get a similar or equivalent amount last year, which
We did
leads
not.
me, we did not.
We did not.
And which leads me to my next point. So I don't remember exactly, but obviously COVID has caused the facility not to be running at an optimal level over the last couple of years because of COVID. The number I don't remember exactly is last year we were probably in a deficit 4 to 5 million. Do I have that correct? Or somewhere in that range?
6.
We were 6 million in the
Approximately
deficit.
6, yeah.
Okay. But I'm seeing improvement here, which I'm not sure how we're doing it, but I assume you're trying to turn the ship around. Ship takes a long time to turn around, but I'm actually beginning to see it because and correct me if I'm wrong,
Okay.
I'm seeing basically revenue seem to be up 1.7 million over, and this is just back of the envelope calculations over last year. That's a good thing. I'm
going to correct you on that.
Okay.
The difference is that if you look down on the bottom, 3.2 million has not yet posted to the 2021 results, but 2022.
Oh, it did post in 2022 and it didn't yet
Yeah.
last year? Oh, so everything I'm saying is out the window now.
Well, as far as on the revenue side, yeah,
Well, then that means we're in the hole,
we
like
are.
1.6 million or so. All right, so we're not in the positive 1.7. Okay, I'm glad you corrected that, because the next part, unless you correct me, it looks like our expenses are down like about 1.85 million over last
Yeah, right.
year, which will overwhelm that deficit we talked about, 1.6. So we're up about 200,000 or 300,000 this year, which I guess is okay. I
Yeah,
was hoping it was a lot more. Plus the 3.2 million means that we're about 3.4 million better off right now than we were last year. Am I about right on that?
yeah, you have two, on the revenue side, the positives is that your IGT revenue is higher than it was last year,
Yeah, but I'm-
589.
Okay,
And on the emergency funding that we got, that's also up 3.1. So on the revenue side, you have positive. And what you're seeing on the expense side
Mhm.
is that you're seeing this year versus last year, we're $1.8 million difference.
right. How are we controlling those expenses better, 1.8 million this year than last year?
Well,
Because that's part of turning that ship around, I assume.
some of it's actually not even voluntary. We're not turning the ship per se. What's happening is we have a $1.2 million difference in personal services this year versus last year. That would be attributable to the number of vacancies the facility has.
The number of vacancies that we have.
Empty positions
Empty
not filled.
positions.
We have chosen not to
Funded
fill.
but not filled.
Correct. We
Funded
have
but
chosen to
not
fill
Funded but
certain,
not filled.
we have chosen to fill certain non-nursing positions that have become open to save money because we don't believe they're needed at this time based on census.
Based on census, because you only have you have 30% less
Correct.
people than you.
Correct.
Or 32% less people than you usually would have.
Correct.
Correct.
All right. So net, we're slightly a little better off than we were last year, but not as much as I originally thought. Okay, thank you very much.
Thanks for trying. We appreciate it.
We so appreciate it. It is a bumpy ride to say the least, but we're doing it.
Everything is incumbent upon our staffing, and we can't grow our census without the staff, and that hasn't changed. So, and that's going to be the greatest challenge for us going forward.
And have you gone through budget? You started the budget season
Today,
with the executive?
Yes.
Today you started.
we did, yes.
Okay, and I assume budget will look much different this year, going next year than it has in the past? Or there'll be some major changes in the budget?
There will be changes with
You're gonna
regards
budget
to
the lower
occupancy,
census.
right? Lower census, so our revenues will be, that will have a different flavor than they have in the past. This year it was budgeted at 90%.
Right, which I thought was 90 or 92%, which I thought was a little, was not achievable in my opinion. What are we gonna be budgeting this year at, 68%?
70.
70%,
Right.
all right. I don't know how to phrase this, but we're still gonna have a shortfall even if we budget at that level.
Correct.
Correct.
It's still gonna probably be a 4 to 6 million shortfall even at that level. And we're gonna have to take out of
Correct.
your
Correct.
monies. Okay, all right.
Yeah, we have 28 positions we're not funding for the 2023 budget that we funded for 2022.
Okay.
So, and the savings for that was not as significant as we wished, believe it or not.
Including the salaries and the benefits, and it wasn't as much as you would have.
Correct.
Correct.
And all those positions, there's nobody in those positions, so nobody's getting laid off.
Right.
And unless the census were to go up dramatically, you wouldn't need those positions.
Correct.
Correct.
But you have no one to fill them anyway, I assume.
Correct.
Correct.
Okay, all right.
Well, we could, certain non-nursing positions, we could probably fill, but
Yeah.
we're choosing not to.
Okay. Outlook for IGT next year in the same ranges as it's been in the past couple of years?
We haven't actually received any new updates on the IGT funding.
Yeah, we were just talking about this morning as well. We should be getting notification sometime in September for our next payment.
Yeah.
But you have to remember, our Medicaid days are gonna be down. We're hoping that everybody else's Medicaid days are down the same
The same.
as we are, so
Put you in
the,
the same boat.
right,
Exactly.
exactly, exactly.
Okay.
So,
Correct.
Which would bring
So-
you to the same levels that you've been in the past.
yeah, I mean, it's all up in the air. We don't know.
Okay.
It's,
You
Thank you.
gotta take out the crystal ball and. Yeah,
Okay, thank you.
yeah. If you turn to the next page, you'll see the analysis showing, historical occupancy. For July, our occupancy was 67.84%. Year to date, we're averaging 68.67.
Quick question. So again, I don't know how to phrase the question, but all the nursing homes, the for-profit ones are suffering as much as anyone else. Are any of them in Orange County, to your knowledge, in a situation where their viability going forward is in question? And if so, would that lead to an opportunity to pick up staff if we were proactive in advance of that? Does any of that make sense?
yeah, no, I know
Yeah,
the
we're
question,
back.
I don't have the information. I wish I knew if that was the case, if we read in the paper tomorrow that XYZ nursing home is closing, I might be outside the parking lot the next day, giving out applications, but I don't have any knowledge of that. Yeah, it's hard to tell.
Okay.
I don't know what the finances are or circumstances
Just
are
putting
for
it out
each
there.
place. Yeah, no, believe me, we would, we'll be out there if we hear something, yes.
Okay, thank you.
Okay, I think that's it for the finance, right? Covered everything? Yes. So, the update, I sent out the update, you have our census information. We still have the 3 units closed. We are accepting short-term admissions. We are accepting some long-term admissions when long-term beds become available. One of our positives is our Valley View CHA. Our census is 24. The census has been strong for the CHA for consistently now for a month or two, so that's good. We did have 2 additional employees test positive today, so the number of COVID positive employees is 4. We don't have any positive residents. There's no units currently closed, currently on precautions, and visitation is still allowed. Darcy mentioned this in her presentation earlier. The New York State Department of Health finally sent out guidance for the healthcare worker bonus program that was in the New York State budget. Under this program, employees are eligible based on specific working titles and minimum hours worked during designated vesting periods. They are eligible for a maximum of $3,000 bonus. So we are working with the county HR to ensure proper submission information. The first submission due date is September 2nd. We have to, since we are the Medicaid provider, we have to apply on behalf of all eligible employees. And what happens is we'll be paid in our Medicaid payments, and then we'll pay out the employees. Then we have 30 days to do so after we
From the
receive.
receipt of the payment.
Right, so recruiting and hiring nurses is still a major challenge. We did attend a healthcare job fair last week. We received a few applications for per diem CNA and food service helpers and home health aides, but no LPNs or RNs.
Okay,
One more quick question.
yes.
I don't know that I've asked recently, but the rehab unit, what's the status on the rehab? How is it performing? Because I know it's been a profit center in the past, a very good profit center.
So we only have 1 rehab unit open, and I don't have the census of it with me today. I didn't.
Well, it's running about half, 15.
It's right around
16.
15% of 30 beds, yeah.
Yeah,
So it's half of what
Yeah.
usually
Half of-
would have been.
yeah, well, we used to have 60 beds. Right now, we have one of those short-term rehab units.
On that, going down to 15 beds, so you're
30
30.
beds,
30 and 15 occupied.
correct,
So even that is suffering.
right.
Okay.
That's
thank you.
really a component of staffing though, right? You can't fill it.
Well, we have to have a COVID designated area, and we have a couple of rooms on that unit that we like to reserve for, because we do have residents that test positive, and they have to be moved to a designated area, so that is the same area that we use. So we do have a couple of rooms that we don't fill. So plus you have to remember the short-term, I don't think the referrals from the hospital have been as strong as in the past. And the short-term rehab people come in, they're really majority of them are short term, they're in and out. You know, it's a quick turnaround.
Okay, thank you.
Okay, any other questions, comments? No, if not, thank you very much.
Thanks.
Thank you, Lawrence.
Yep, of course. Thanks.
Okay, next up, we have Dr. Rena Gelman, Commissioner of Health, Chris Erickson, Deputy Commissioner, Health Department, and I don't see Mike Ventry, so we have the Commissioner and Deputy Commissioner. Thank you. Being here.
had to step away for some stuff. Still pending.
As you,
We're on mute.
okay, as you know, we don't form, so, this will be rolling over to Ways and Means. And if you wanted to just give us a little brief rundown, I think that they all passed, yesterday.
The first one will be rolled over to Ways and Means, and the following ones were passed yesterday at PNC, and you could probably talk about them collectively, because it's all about the medical examiners, staffing.
Great.
Thank you very much, Mr. Chairman. I will defer to my deputy.
Okay, so the first agenda item is just accepting the funds for the Migrant Health Services Program. And that is the one that we've had for many years now. And again, this purpose of the grant is to provide access to high quality and cultural linguistics, appropriate health and social support services. It helps to fund a part-time seasonal community health worker who works throughout the county during the growing season. Primarily assists with farm owners and migrant seasonal farm workers to assess care and provides relevant public health education. Again, this is a long-standing grant that we've had in place, and this again is to fund it through the period. So that's your first agenda item. And as far as is there any questions on that?
No, I don't have anybody else.
The other part of this is, again, the positions that were in the personnel and compensation meeting yesterday. And again, as I explained yesterday, from the 5,000-foot view on this, there's 2 autopsy assistant positions that are there. There was a desk audit done because the medical examiner felt that those positions were not classified appropriately. Desk audit did find that they were not classified appropriately. And so they were reclassified to a higher grade level on that. In doing so, what they did was they also created a little bit of a hierarchy in there, which starts with a trainee, goes to an autopsy assistant, and then goes to a senior autopsy assistant. It's still only 2 positions. The trainee position comes in when someone comes into a position that doesn't have enough experience. They basically put them in that for a year. After 1 year of time, they automatically get put up to the autopsy assistant position. There's several positions like that within our department that start off as trainee and then go to the actual position, but it's something that you do when somebody doesn't have enough experience, basically. And so this, the medical examiner is very happy to get this going in the right direction to help retain and keep people in those positions, which is very important.
Have you had a trainee recently, or?
No, so this will be the first time a trainee is ever. Yeah,
Great. Well, thank you for that.
Yeah.
Bringing them all on.
Yeah, so I think that's it. And then Dr. Gelman has the monthly update.
Thank you very much. In terms of the general overview, our summer programs are regulated by the department and are fully operational. These include pools, beaches, spray parks, children's camps, both overnight and day camps, in addition to fairs and festivals. The Environmental Health Division has staff in the field 7 days a week now to keep up with the demand of public safety. The Environmental Health Division is also very busy with engineering plan reviews for water supply, sewage, septic systems, subdivisions, and pool and construction. The department is holding COVID vaccination clinics by appointment only in our Newburgh and Middletown offices. And of course, vaccines are available in provider offices and pharmacies. The nursing division continues to provide booster vaccinations to homebound residents when needed. We continue to monitor for monkeypox in Orange County. Orange County currently has 8 cases. Case counts are updated on the New York State Department of website daily. Coordination with the New York State Department of Health in securing monkeypox vaccine, the administration, as well as redistribution to other providers in the county is ongoing. The department has also been collaborating with the CDC. As a matter of fact, as I mentioned, I am on the daily call that is currently pending, is muted. The New York State Department of Health and the CDC, as well as the local medical care providers, have been collaborating with us on our polio response and the polio vaccine administration and reallocation, since Orange County is an area of increased risk. This continues to be a developing situation. As you know, a number of public health alerts and press releases have gone out regarding the positive findings in wastewater in Orange County, as well as a confirmed case of polio in a resident of Rockland County. To date, we do not have any confirmed cases in Orange County residents as of yet, but the wastewater analysis consistently and persistently is showing polio virus presence, indicating community transmission in Orange County.
How is it exactly transmitted?
Polio is predominantly transmitted via fecal-oral route or oral-oral route in some cases. And in terms of wastewater analysis, the wastewater COVID analysis project at 6 different wastewater treatment plants, and we're actually very proud of the wastewater analysis project. I know initially when we started out, it was sort of a foreign concept to begin with, but we have one of the more robust programs. We have implemented that program very early on, providing us with a wealth of data, really data that we can correlate with our epidemiological syndromic surveillance and really guide any protective measures and notifications. So when we're coupling that early detection in the wastewater with early notification, it really does wonders. So we started out with just SARS-CoV-2 with regards to COVID, and then we did request actually from the State Department of Health that they test the wastewater for monkeypox virus, for polio, and for measles. They have subsequently tested for polio due to the confirmed case in Rockland, and of course CDC did report those specimens testing positive in Orange County. They're also testing New York City and the adjacent counties to New York City as far as wastewater surveillance. We expect
When they do that, when you see a spike in polio or one of the other diseases, what kind of lag time is there? So if we're seeing it on a report today, on a test today, what, how far back is that going? Or where does it tell you and when it happened? And then what's the look down the road with it?
So currently, to date, the wastewater has only been monitored for SARS-CoV-2 with relation to COVID-19. With COVID-19, we had a distinct week to a week and a half window between seeing that spike of viral burden in wastewater of SARS-CoV-2 and what we're seeing as far as, yes, absolutely, the symptom presentation and with individuals presenting for testing. So that was about that week to week and a half, allowing for the early detection, early notification. We have not monitored for any other communicable diseases. You can, not just viruses, bacterium as well. That has not been common practice nationwide and statewide. It is something that we have continuously requested for months now, but it's just has not been scaled just as yet. Clearly, testing wastewater is a lot easier and more prudent than scaling individualized testing for any virus or emerging communicable disease. So it's a work in progress and continues to be, but for us, predominantly the concern was really post-COVID, was really measles and polio because of the global situation and our low vaccination rates. And currently, obviously, polio is the predominant concern because of that confirmed case in Rockland County. And that was a paralytic polio case tonight.
Legislature.
Okay, are we done? So I don't want to interrupt.
There's more, but
Yeah,
I'll be glad
but I
to
didn't know if it
answer you.
applied to
No,
right
no,
now.
no, I thought we were done with the.
Okay, no.
Okay, thank you. We expect there will be an expansion to other municipalities with testing of their wastewater starting in the next months. Analysis shows that there continues to be active viral loads in wastewater indicative of disease transmission in our communities, and hence residents should continue to take precautions. Analysis of wastewater has been expanded, as I've mentioned, for polio, and the New York State Department of Health has advised the Orange County Department of Health, I believe at the end of July, that the polio virus has been identified in wastewater samples taken from June and July. That becomes important because the CDC is continually testing the specimens that we have submitted previously. So they're still testing via PCR for presence of viral load, and then genomically sequencing them, and that takes a lot longer, so that's still pending. Poliovirus has been identified, as I mentioned, samples taken in June and July from 2 different locations in Orange County. Although there have been no confirmed cases of polio identified in a resident of Orange County to date, the virus is circulating in the community according to Wastewater Analysis. We are continuing to monitor this and are working with the New York State Department of Health in securing vaccine for individuals who may be at risk and may need it because of being unvaccinated or under-vaccinated. So clearly this remains a concern for unvaccinated or under-vaccinated individuals. And we're simultaneously working with both the communities that may be in increased need and medical providers as far as diagnosis, recognition, and treating this as a differential diagnosis that's there. You do see the COVID reports before you. In the interest of time, I won't go through them line by line, but I will answer any questions.
Yeah, overall with the COVID, what are you finding on now? Is it,
We're seeing small increases, but they're not persistent just as yet.
Yeah.
They're increasing, leveling out. So we're continuously.
Any new variants coming down the line?
There is an anticipation in the fall, but again, the virus continues to mutate. So depending on the number and the name that they assign to this newly mutated strain, we will come to find out about it as it's more prevalent in the fall.
Okay.
So that was my question. My question was going to be in terms of COVID. My observance is that death rates are lower. They're going down, and not only that, I think I saw here, but I think that's true other places too. The median age of the people dying is going up substantially, which to me kind of leads me to believe that the rates are going down and the death median ages are going up. So it's becoming less and less lethal and a problem. And I think a very good indicator of that is the fact that I see you here today without a mask.
Yes.
First time ever, I think. So am I right in that? And we're at the stage, I think now, regardless of whatever our new mutation is, it just will be a background thing that is here forever, but we're back as normal as we can be.
As normal as we can be, I think, is a very accurate description of that. As you noted, the CDC is also changing their guidelines, despite of the fact that obviously incubation periods for viruses do not change with the CDC guidelines. But you're absolutely correct. We're in a very different place today than we were at the beginning of the pandemic response in terms of having available vaccine, even vaccine that's incorporating these different variants, that's accommodating that, a lot of the treatments that are available. So we're in an entirely different place today.
And I should have also thrown into that equation, the rates are going down and the median death rate is up, even though we're at the point now where the booster shot should be waning amongst just about everybody that ever got a booster shot.
Absolutely.
So really, that booster shot is not helping anyone. It's waned away, and yet we're at the stages that we just
But
talked
also the
about. So
prevalence is very low right now. So into the fall, you will see an increase in cases. I have to preface it with that. In the fall, you will see an increase in cases.
why? Simply because we're indoors at that point?
We're indoors and the circulation, we're seeing increasing circulation globally. We're also looking at global trends, so they tend to make their way over as well. Just
Are we
simply
seeing it
because
anywhere globally where it's picked up to levels that it was in the last year or two that led us to panic?
in the last fall, I wouldn't say panic, but to
Because they're
levels in the
panicking in
last-
China. They have one case somewhere and they shut a whole city
China, they
down.
have a
10
number of
million people.
viruses now pending. There's Marburg, there are a number of new novel, completely emerging zoonotic transmissions that we're still monitoring for as well, but I don't think we'll kind of dive into that today.
I think what I take away is I don't see you with a mask, and that's a good thing.
Yes, that's typically a good indicator.
Chairwoman Fidelli?
Just real quickly, could you identify or clarify a little bit more when you say under-vaccinated?
Yes.
What does that actually mean?
Absolutely. So polio vaccine is a series of vaccination. Typically for older individuals, that would include 3 vaccines. And for now, as far as recommendations for pediatrics, that's 4 vaccines. So individuals who have not completed their vaccine series are still susceptible and vulnerable to contracting and transmitting. That's essentially in a nutshell.
Thank you. And if I may, Mr. Chairman, I would like to thank both of you and congratulate you on the new chapters and that you're working on in your lives. You've been a true asset to all of us here in Orange County. We appreciate your professionalism and your caring attitude, especially during the pandemic. It was a very difficult time, and both of you rose to the challenge, and we're all very grateful for that. So I wish you the best of luck, and thank you so much.
Thank you very much.
Thank you very much.
Because this most likely is you're going to be your last meeting.
It's most likely will be our last, and I will say that it's definitely been an honor and a privilege, not just to work with a very caring legislature and very involved. If a testament to that is just the mental gymnastics alone in a lot of our discussions, but also just the overall caring and vested attitude. A lot of you have been champions for public health, and we really thank you for that. That has not been the case nationwide and even statewide in other counties. So we're very appreciative of how much you have invested of your own times, but also just being advocates for your communities, for better or for worse at times in the public health realm, but we're very, very grateful. And we have an incredible team at the Orange County Department of Health. And that's also a testament of the legislative.
Well, again, thank you and congratulations and best of luck.
I just want to add to that too, that it's a sad day. We both will possibly not be back with us. I think, because you're coming up in a day or two, right?
My last day is Friday.
Friday, okay. And doctor, when is yours?
September 9th.
September 9th. So this is the last day. It's a sad day for us to be losing you, but it's also a very, very happy day. Cannot thank you enough for everything that you've done over the short time I've been here. I think, Doc, you're here 4 years, I was here 5, I'm in my 5th year, so I was a newbie when you came, and Chris, you were here, and your wealth of knowledge certainly helped me in those early years and beyond, and it is a happy day because you're both moving on, and you both seem very happy about it. You're going to 2 exciting places, Westchester's. I worked 35 years down there in Westchester, and my first question is, you moving down there, you can go to Tappan Zee or the Homer Bridge every day?
No, I live on the other side of the river. So
Oh, you do?
yeah.
So you gotta do
I'm
the.
I'm
so
just going north-south.
So now
Instead
that,
of east-west.
congratulations, congratulations. And Doctor, I understand you're going to Nassau County as
Nassau County.
Commissioner of the Health Department out there. Well, I wish you all the best, and that sounds like a really exciting place to go. Isn't that where the Hamptons are and stuff?
Yes, that's
good
right
stuff?
across Suffolk, right there adjacent to us.
Oh, that's
But
right.
all the beaches,
Yeah,
yes,
it's all the beaches,
Jones and Sharks and all
Yeah.
that stuff.
As you can tell, Dr. Gilman loves going to the beach.
Yes,
She's there all the time.
absolutely, yes, as my tan complexion.
Well, wish you the best and safe travels, okay?
Thank you.
Thank you very much. Thank you.
Thank you, Mr. Chairman. I also just wanted to echo the sentiments of the chairwoman and our chairman. To both of you, first off, congratulations. It's definitely bittersweet because, we are losing 2 individuals who have done such remarkable work here in Orange County. I've had, the great pleasure of working with you over the course of the last 5 years in particular. You've always been amazing with us. Really just, steering this ship during a pandemic, in very unique, very difficult times, with some very, very difficult conversations, sometimes with some legislators who are who are getting a lot of pressure from the constituents. You have always been very detail-oriented, very empathetic, very passionate. And so I just want to thank you on behalf of our communities as well, for being a leader in public health. And it's been an honor to work with you. And so we wish you both the best in your future endeavors. And I hope that you won't be strangers to Orange.
Thank you. Thank you.
This is always also your home.
I would just like to say again that, this department here is an amazing department. And there are, as Dr. Gelman said, there are staff in this department that, work every day so hard to protect the people of this county. And, many times they go unrecognized and they just do their work, but they're an amazing group of employees who will continue to do that. And it's been a pleasure being the deputy to Dr. Gelman.
For the most part.
Yeah. Always been a pleasure. I've had the opportunity working for several commissioners and this has been awesome, working for Dr. Gelman. So, I will miss that. We've already had some lunch dates planned, her coming up from Nassau, me going down from Westchester or something like that. But, and then just to finish off that, nothing gets done, with us here in these committees without, the exceptional staff of the legislature. So for the legislature body to get our agendas through, to move things through, and we needed to, working with Doreen is my person and has always been, is really important. If I need anything done, I know I could always call her and get things done right away. So we will definitely miss them also.
And Doctor, you're going to Nassau County?
Nassau.
Oh, I'm sorry. Hey, my whole time since I learned that you were leaving, I thought you were going to Suffolk County.
No, Nassau. County.
Nassau, okay, so that's not.
There's beaches there too.
A few.
But it's not that far.
Nah, that's not just, but
Good.
Thank you very much.
congratulations.
Thank you.
Thank you.
Thank you. With nothing else on the agenda and I don't need a motion to adjourn, so meeting adjourned.